Hi, welcome to another episode of Medicine Simplified. Today we will learn about bulbs of mastication, their origin and insertion, and their functions. Let's know more about masticatory muscles. Bulbs of mastication are group of muscles responsible for chewing movements of mandible at TMJ joint. They assist in grinding of food by opening and closing of mandible and also function to approximate the teeth. Muscles of mastications are divided into principal masticatory muscles, accessory masticatory muscles. Principal are primary muscle groups aid in movement of mandible. It consists of 4 paired muscles, 4 on each side of mandible. First one is Masseter, second temporalis, third medial pterygoid, also known as internal pterygoid, fourth lateral pterygoid, also known as external pterygoid. So coming to the Masseter, it is a quadrilateral shaped muscle. Consists of 3 layers of fibers. Coming to the origin of Masseter, superficial layer, which is the largest one, originates from lower border of anterior two-third of zygomatic arch, adjoining the maxillary process of zygomatic bone. Middle layer originates from lower border of posterior one-third of zygomatic arch. And final deep layer originates from deep surface of zygomatic arch. Coming to the insertion, it is inserted at lateral surface of ramus of mandible. Coming to the nerve supply, remember all masticatory muscles are supplied by mandibular branch of trigeminal nerve. Masseter muscle is supplied by Masseter branch of anterior division of mandibular nerve. Coming to the action of Masseter, it aids in elevation of mandible, protraction of mandible by superficial fibers, retraction of mandible by deep fibers of Masseter. Coming to temporalis, it is a fan-shaped muscle and bipinnate type of muscle. So what is bipinnate? A muscle with fiber that are arranged obliquely on both sides of central tendons. Other bipinnate muscles are stapedius and biceps brachii. Coming to the origin, temporalis originates from floor of temporal fossa below the inferior temporal line. Coming to the insertion, it inserts into coronoid process of mandible. Nerve supply, it is supplied by deep temporal branch of mandibular nerve. Coming to the actions of temporalis, it helps in elevation of mandible, retraction of mandible. Coming to the third muscle, that is medial pterygoid, also known as internal pterygoid. It is a quadrilateral shaped muscle. It arises by 2 heads. First one is superficial head, which is smaller in size. Second, deep head, which is larger in size. Coming to the origin, superficial head originates from maxillary tuberosity and lateral surface of pyramidal process of palatine. Deep head of medial pterygoid originates from medial surface of lateral pterygoid plate. Coming to the insertion, medial pterygoid is inserted at medial surface of ramus of mandible below and behind the mandibular foramen and myloid groove. Coming to the nerve supply, it is supplied by nerve of medial pterygoid, which is a branch of mandibular nerve. Coming to the actions of medial pterygoid, it helps in elevation of mandible, protrusion of mandible along with lateral pterygoid muscle, side to side movement, that is lateral movements of mandible with the help of lateral pterygoid. Coming to the final muscle, that is lateral pterygoid, also known as external pterygoid muscle. It arises by two heads, upper head and lower head. Coming to the origin of lateral pterygoid, upper head originates from infratemporal surface and infratemporal crest of greater wing of sphenoid. Lower head originates from lateral surface of lateral pterygoid plate. Coming to the insertion, lateral pterygoid muscle is inserted at two places. First one is pterygoid fossa at anterior surface of neck of mandible. Second one at capsule and articular disc of temporomandibular joint. Coming to the nerve supply of lateral pterygoid, it is supplied by nerve to lateral pterygoid, which is a branch of mandibular nerve. Coming to the actions of lateral pterygoid, helps in depression of mandible, protrusion of mandible along with medial pterygoid muscle. Also helps in side to side movement, that is lateral movements of mandible. These are four primary muscles of mastication. Now let's learn about accessory muscles of mastication. These are strap muscles composed of suprahyoid and infrahyoid muscles which are located on sides of neck bilaterally. These strap muscles assist in depression of mandible when opening the mouth. If you like this video, please like, share and subscribe to our channel. Thank you.